CBS New York is committed to breaking the stigma surrounding mental health. September is Suicide Prevention Month, and this is also Suicide Prevention Week, during which we will be exploring a number of topics about mental health. Today, we're talking about postpartum depression, and joining me now over Zoom is Wendy Isnardi, the resource coordinator for the Postpartum Resource Center of New York. Wendy, thanks so much for being here to talk about this important topic with us this morning. We greatly appreciate it.
Thank you for having me.
So this topic is a one for you. Can you talk about why you are now an advocate for parental mental health?
Absolutely. About 21 years ago, I got pregnant with my first child. I had an amazing pregnancy. I wound up having an emergency C-section, which wasn't what I expected, but I was okay. I couldn't wait to go home and be a mom. You know, everything was great. And then about 3 weeks postpartum, everything changed. I was very anxious. I had horrible panic attacks, scary, intrusive thoughts. I didn't want to be alone. I cried all day long, and I watched my mother and my husband take care of my baby. I hated myself. I wanted to die. You know, all I wanted was to be a good mom and love my baby. That was it. I ran into my Lamaze coach, and she gave me the number to the Postpartum Resource Center of New York. And that phone call literally saved my life because I was hanging on by a thread.
It must have been such a trying time for you, because it's supposed to be the happiest moment of your life. You've got this newborn baby, but then you're struggling with these emotions that are really counterintuitive to what the whole experience should be like.
Exactly. It just was not what I expected. You know, everybody talked about the baby blues, but what I was going through seemed much more severe. So when I made the phone call to the PRC of NY, it normalized what I was going through. Like, for the first time, you know, someone was, you know, giving the exact symptoms of what I was going through, and they gave it a name. I had postpartum depression. I wasn't alone. It wasn't my fault, and I was going to get better, you know. But in the beginning, I wasn't so convinced that a doctor, a support group, a pill was going to change what was going on inside of me. And that's where I made a promise. I was on maternity leave, and I wasn't convinced that I was going to get through this. So I said that if it was that I got better, that was it. I would dedicate my life to helping moms. And 21 years later, here I am.
Some people would say that you wrote the book on this, and you actually did write a book about it. So you really
yes,
the proof is in the pudding. You have devoted your life to this. Tell me about the book, and just some things for people who are watching right now, signs and symptoms that they should be on the lookout for if they think they're potentially suffering from postpartum depression.
Gotcha. So I had written the book. I was ultimately diagnosed with postpartum depression and obsessive compulsive disorder. Now, prior, you know, I thought OCD was, you know, excessively washing my hands, you know, being afraid of germs, but it was also a thought process. And it was very, very intrusive thoughts that were usually circled around the baby, which to a new mom is extremely distressing, especially when it's not expected. A lot of times OCD can be confused with like a psychosis. Postpartum psychosis is very rare. It's a medical emergency that affects 1 to 2 moms out of 1,000 births, where OCD is more so an anxiety disorder. It's intrusive thoughts, but the mom knows that they're intrusive, you know, that they're not hallucinations, you know. So the symptoms of psychosis would be like hallucinations, delusions, mood swings. They have suicidal and infanticidal thoughts or actions, you know. So there's a very, very big difference, but it's very important that moms understand the difference. It's important that moms reach out. They should never be afraid to reach out. And we need to lose the stigma with mental health, especially with postpartum moms.
And obviously the Postpartum Resource Center of New York can help for a lot of the things that you're talking about right now. But as far as treatment, for some of the things you're talking about, what would, I guess, your best advice be for people who are getting that need treatment for something like this?
Well, moms in New York State need to call the Postpartum Resource Center of New York, and we can definitely show them the way. But therapy, which was what helped me, talk therapy, you know, finding a therapist that I trusted, that I could share. Medication, if that's an option for moms, if it's needed. I happen to be a mom that needed it. And support. You know, you can't put a price on peer support, you know, mothering the new mother, especially in this time.
And Wendy, before I let you go, when you think back of the way things were for you years ago when you first started suffering from postpartum to where you are now, is it tough to process that you were in that position back then?
Yeah. And, being with the Resource Center for as long as I've been with them, we finally got a grant from the Mother Cabrini Health Foundation. So it provides us with resource coordinators, peer coaches, bilingual. We have virtual support groups, helplines with moms and dads on call because dads suffer too. Yeah. Including family support for the family members. We give free and confidential information, mental health, healthcare, and support group resources. And we just want to mother the new mother, the pregnant mom, the family, the dad, and get them to the support that they need.
Always good. Always good for people to know
tragedies.
that. Yeah, it's always great to know that help exists out there. Wendy, thank you for your time and sharing your story with us.
Thank you so much. Thank you.
Good to see you. As part of our commitment to breaking the stigma surrounding mental health, this year CBS 2 is forming Cindy's team for the AFSP Walk in Manhattan. That's on Sunday, October 22nd, and we'd love for you to join and walk with us. For more information, we have a link at cbsnewyork.com, and we'll be right back.